So I'm finishing my first official week as an ICU fellow here in Boston. The unit that I'm on is the trauma ICU, and we have a couple of patients who have liver failure. So I thought this would be a good time to go over what the MELD score is and talk a little bit about what it means regarding liver failure. So MELD stands for Model for End Stage Liver Disease, and it was created by the United Network for Organ Transplant. And basically what they were trying to figure out was who needs organ transplants specifically for the liver. And they do this because there's only a limited amount of livers available. So they're trying to get this to the most appropriate patient that they feel needs a transplant. The MELD score basically uses four different components, which I'll go over, and helps predict 3-month mortality based on how high that patient's score is. The higher the MELD score, the higher the 3-month mortality rate is, and it has an exponential curve to it. So when patients have low MELD scores, they're most likely going to do fine. However, once they start climbing up in their MELD scores, their mortalities can increase quite significantly. And because the liver physiology is constantly changing, patients who have higher MELD scores will tend to get their MELD scores calculated more frequently so that we can be aware of any fluctuations, where patients who have lower MELD scores may not be monitored as frequently. The MELD score can be anywhere between 6 and 40. And one of the first components that goes into it is bilirubin. Bilirubin is also sometimes called bile, and this is something that the liver excretes. And if the liver is not functioning properly, you may see an increase in the bilirubin. This can lead to jaundice in either the eyes or the skin, but knowing the numerical value will contribute to the MELD score. The next thing that gets input into the MELD score is the INR of prothrombin. This is because the liver makes clotting factors, and if the liver is not functioning properly, then these clotting factors are not being made, and you may start to see the INR go up. You can also start to see bruising or bleeding in these patients because they don't have the clotting factors. Next, we look at creatinine, which is a sign of the function of the kidneys. The liver and kidneys have an interaction in terms of how they handle fluid. And so if you start to see renal dysfunction from a rising creatinine, this could be a sign of worsening liver function. Lastly, the thing that we input into the MELD score is going to be sodium. As we start to see hyponatremia or low sodium levels, because this can be a sign of decreasing liver function as well. The actual calculation that was created to determine what the MELD score is using these four different components is quite complicated, but there's a lot of calculators out there that you can either use on your phone or use on the computer, where you can just plug in these values and then it will give you the MELD score. So again, to summarize, by using this MELD score and by keeping this updated every time a patient either has a change in their clinical status or just regularly over time, depending on how sick they are, this will allow us to make sure that the sickest patients and the ones who have the worst liver function are at the top of the priority for liver transplants.